Great. All right, so welcome to all of us here for indicating interest in learning more about addressing social and gender norms using social and behavior change. This is Breakthrough Action Nigeria lessons from engaging community in Northern Nigeria with Adalci as a guiding principle. I am your facilitator for this group, and I'll be supported by Marcella as the note taker. My name is Chizoba Onyechi, and I'm the Senior Program Officer for Breakthrough Action Nigeria. So just a brief overview of Breakthrough Action Nigeria. Breakthrough Action Nigeria goal is to increase the practice of 17 priority health behavior, maternal newborn child health plus nutrition, family planning, reproductive health, malaria, and tuberculosis. And the project uses an integrated SBC strategy in a coordinated multi-channel approach across community mobilization, which includes community social and behavior change. In this area, we engage with community health volunteers to promote information across 17 priority behavior at the community level. Also, community capacity and sustainability. Here, we engage with community government structures, known as World Development Committee, to support communities obtain, strengthen, and maintain their capabilities to set and achieve their own development objectives. Also, Women Empowerment Group. Here, we create opportunities for women in communities to have safe spaces to learn about MNCH, nutrition, and other issues, and engage in activities for economic empowerment in community spaces outside their home. Then mass media, which is our bedrock. We use umbrella team such as Abishurinku for the Northern Nigeria, which means glad tidings, and also Jidekiji for the Southeast Nigeria, which means well done or continue doing the good work that you're doing, to promote radio drama across 17 priority health behavior. Mobile digital, here we use different mobile platforms, particularly the interactive voice response for mobile curriculum across all our stakeholders. We have behavior change for service providers. Here we try to address barriers and promote positive behavior to improve quality of services and improve client experience and health outcome among the service providers. And most importantly, advocacy, where we engage religious, traditional, and opinion leaders to promote positive social and gender norms across 17 health priority behavior. Now, a little bit overview of Breakthrough Action Nigeria gender strategy. In the section of the project conducted a gender assessment, and evidence from that assessment suggests that gender-related factors create significant barrier to assessing the practicing health behavior. Likewise, the project also conducted a human-centered design formative assessment to learn how they might radically improve MNCH in Northern Nigeria. And from this assessment, one of the insights showed that many women do not have the agency or ability to make decisions and take actions concerning pregnancy, childbirth, or child health. So based on this feedback from all the different assessments, a gender strategy was developed. And the gender strategy is rooted in creating environments that enable achieving gender equality and sustain health behavior change. And one of the major guiding principles for this strategy is for the project to effectively engage male and female religious leaders as advocates for gender equality to help shift gender norms and leverage on positive religious belief system. This is because religious leaders are major influencers of social norms at the individual community level in Nigeria, particularly in Northern Nigeria, where the concept of adults is generally accepted. So what is this adalci that we're all talking about? Adalci is a Nigerian Hausa for ensuring fairness and justice, and it's a principle used to guide day-to-day interaction in communities and family settings in Northern Nigeria. And the rules of adalci are largely defined by the religious and traditional laws and social norms. So In the project, Adalci provides a culturally appropriate overarching framework for the Breakthrough Action Nigeria strategic approaches in northern Nigeria to achieve gender equality and sustained health behavior. So because we know that gender roles are deeply rooted in culture and tradition, Breakthrough Action Nigeria Social and Behavior Change Advocacy Core Group provide an appropriate platform for integrating gender within the Adalci framework. So who are this social and behavior change advocacy core group? They are basically a group of religious, traditional, and opinion leaders who are custodians of community values and best placed to influence community norms through Adalci. And they are well positioned at the community level to engage all structures at the community level to improve the health status of women, children, families, and communities. With Adalci as a guiding principle, the group aims to influence positive practices related social and gender norms to achieve improved MSH and issue limited mobility of women on early marriage, childbearing, so for the base traditional nutrient, traditional practice for MSCH problems. So this group are planned to focus on breakthrough action priority health behavior as an entry point in addressing related social and gender norms, such as I've just mentioned, within the Adalci framework. And they actually use different channels to directly address these issues. And some of them are mentorship. So in mentorship, they help other clerics who are not part of their group to learn messages about priority behaviors. Sermons, they integrate messages on priority behaviors and social and gender norms into all of their activities at the churches, at the mosque, as social and community events. Everywhere they find themselves and they have opportunity to speak, they make it a point of duty to integrate priority behaviors into their messages. Mass media, here they are engaged with the media houses to speak about behaviors and address beliefs and misconception. And of course, modeling. We encourage them to model positive health behaviors in their families and communities, particularly to build trust among the community members, and also for people to also believe in what they are doing. So basically, over the inception of the project, we have learned a lot of lessons through addressing gender norms using Adalci. So one of these is that we have recorded significant increase in female representation in the group SBCACGs from 15% to 30% from project inspection till date. And this has significantly impacted on the group's activity, which were previously dominated by male religious leaders. And these female religious leaders now on their own plan activities, execute them independently, although the activities still guided by Adalci and designed to address social and community women in other activities, such as participation in the women empowerment group, like we mentioned earlier, and other outreaches activities of other community women within the communities. There are other lessons that we have also documented from feedbacks and voices of the community. However, we know that this still needs to be validated by some level of survey or study. But from the voices of the community, we have also recorded that there has been increased household communication and joint decision-making on health and health-related issues within the household. Again, from the service providers, they have testified that there has been increase in partner support to women attending ANCs and even deliveries and immunization days. Again, maybe this is because there is certain incentives that is also attached to this, because when a woman comes to the facility with their spouse freely with their spouses in the household. Yeah, next week. And apologies. Can we all hear me? Okay, great. Sorry, apologies for that. Okay, so can I continue with the lessons learned? Let me know if that's where you stopped hearing me. Can I continue with the lessons learned, or I'll go back to the previous slide? Okay, great. All right. So again, we have had increase in number of pregnant women, children sleeping under insecticide nets, practicing early and exclusive breastfeeding, and adopting child breastfeeding. This is evidence from routine data that we collect from the facility. And we have seen how this has increased from inception of the project to where we are today. And again, we have number of mother-in-laws supporting daughter-in-laws to attend antenatal care, deliver at the health facility, and take their children for routine immunization. This is one of the major challenges we used to have at the community. The engagement of the women in the SBCACG and encouraging them to also engage with other community women, it has successfully helped us. Oh. So with and with the experience of getting women within the other community groups, learn the benefits of Okay, apologies for that network challenge. So sorry about that. Okay, so just to say that the engagement with the SBCACG is not the only thing that had helped this. There are other activities within the Breakthrough Action Nigeria that have supported this activity across the community. So in general, the religious leaders are major influencers of social norms at the individual and community levels in Nigeria, particularly in northern Nigeria, where the concept of adalci is widely accepted as an appropriate cultural principle for engaging audiences to address social and gender norms. I don't know if you were able to catch me clearly from the beginning. This is the end of the presentation, and I'd like us to share our comments, questions, clarification, observation. You can use the chat box or you can raise your hand. We can give room for about 5 persons to share their observation, or you use the chat box. Any contribution, comment, question? You can use the chat box if you don't want to speak up. No question?
Looks like Cheryl has her hand up.
Okay. Please go ahead, unmute yourself and go ahead.
Hi, I'm Cheryl Turner. I work with the VIM Plus project in Burkina Faso, and I'm not the gender advisor on that project, but I do a lot of the work on the SBC side. And I'm really fascinated by the model that you've introduced. We've done a similar kind of model in VIM Plus, working with religious leaders to promote household decision making. So not so much on the health behavior side, but in a broader gender equity at the household level kind of initiative. And I think that our gender advisor in Burkina might benefit from a more intensive conversation about some of these lessons learned and how to continue to promote these kinds of behaviors and social norms.
Thank you so much. We are open to more engagement with others to foster this conversation forward.
I think one of the biggest challenges that we've faced is I don't think they've been targeting female religious leaders. I think it's been much more men in this context in northern Burkina Faso, and with the security issues, obviously, that you're facing in northern Nigeria, that could have some parallels in Burkina Faso, in Central right now as well. But I think that the issue of getting religious leaders not only to speak from pulpits or religious centers, but to do household visits has been extremely successful where it's happened, but it's hard to get the motivation to do that kind of household level intervention. So any thoughts you might have on motivating these religious leaders to get the messages out in a useful way would be really helpful.
So yeah, so if you see through the model, so having them to do a household level activity, it's really, I feel it might be very stressful for them, considering that they are high-level clerics and they actually have a congregation that they manage. So what we do is we make them utilize opportunities at their convenience, wherever it is that they are engaging with people to, engage in promoting health behavior. So if that works for you, I think it's something that you in Burkina Faso, the gender person can also learn from to adapt.
Thanks.
All right. Any other comment, question? So if we do not have any other comment, okay, yeah, please go ahead, Victor. Unmute yourself and go ahead. Alison, please mute, thank you.
All right, so my name is Victor, and I'm from Nigeria, but I work with No Mission Worldwide. Firstly, I'd like to commend the model that you're using to drive social and behavior change. And because I'm from Nigeria, so I understand, the challenges that, you spoke about or that is being experienced, especially in northern Nigeria. My question would be, how did you, engage with the religious leaders or the opinion leaders to be on the advocacy call, right? So, because I understand that sometimes it could be a challenge, meeting with these people, and trying to convince them to be on this advocacy call. Did you engage with any community personnel who, assisted in reaching out to these very significant religious leaders? That's my question.
Excellent, Victor. At least you can relate more because you understand the setting better. So first of all, we identified these key, now not just ordinary religious leaders, they are actually key influencers that we identified. And we first of all met with them one-on-one. And meeting with them one-on-one is to get their understanding around what exactly it is we want them to do, as an individual first. And then we also made them understand that the approach that we're going to use is not us bringing what they need to do. So for example, if we bring up a particular health issue and the gender issues around this health issue, in their meetings, we allow them to dissect the issues, and then we allow them to find the solutions around these issues. So it's a situation where we first of all identified them, and then we engaged them one-on-one, and then we now had a general meeting where we brought all of them together to share the strategic plan for them to engage within the project. And of course, for Breakthrough Action, they are purposefully focusing on social and behavior change issues. So issues around social and gender norms. So when we take a particular priority behavior, for example, what are the issues around gender and social issues around this particular behavior? And they try to address it. So first of all, they have like quarterly meetings where they pick up, we actually build their capacity in different health areas, and then they actually identify issues around there and, build their capacity on how they will also address some of these things within the community. So basically we identify and engage one-on-one before we engage them as a group.
Thank you very much.
You're welcome. All right, so let's move on to the next point of, okay, it says, can you talk more about how you identified, let me get that. Can you talk more about how you identified the social norms and developed the messaging to address this, and how you're tracking progress as measured against the norms? Okay, so identifying the social norms, they are basically things that we know within the community. So we are guided by 17 priority behavior. So based on our 17 priority behavior, which cuts across different health issues, and maternal newborn child issues, malaria, family planning. So those things are categorized in different health issues. So what are the challenges within the community? What are the issues? So within the group meetings, the religious leaders are able to identify what the issues are. So they talk about, why are women not attending ANC? What are the social and gender community issues, cultural issues that are affecting women not to attend ANC, that are affecting people not to take their children to immunization? So they discuss those issues within the meetings, and they also come up with their particular solutions. So what are the things that we will do going forward, even beyond talking? What else do we need to do? There are other policy issues that they even engage in to help address some of these issues, but we try not to encourage them to deviate too much from the main focus of the project. But sometimes you see them going out of their way or going extra mile to make sure that things are working within the community appropriately. And how do we measure these things? We have a tracking tool. So for every activity any SBCSCG conducts, there's a tracking tool where you track what you've done. And then quarterly, we also have people, voices from the community, and record some stories that we document from them. Like I said, there are some of the things that we might not necessarily attest to the engagement of these people at this moment, especially things that require a high-level study, for us to also attest to the fact that this has actually changed. So our partners, Breakthrough Action Research, conducts our research study, and they are also going to conduct research study to see that how far the engagement of SBCSCG has helped improve priority behavior with the concept of adalci. So when that result also come out, we are going to share widely. And I have another question that says, what are some of the example behaviors? Did you take controversial issues such as family planning? Oh yes, family planning was the first level intervention that we engaged them with. And sometimes I wish we recorded our first level engagement with them, because initially, of course, we know how family planning has always been in Northern Nigeria. And it's always been difficult for anybody to understand. So the word family planning puts them off. So one of the things we did as a project was come back to the drawing board and say, okay, for Northern Nigeria, we are not recognizing. In fact, for the project generally, we're not promoting family planning. We're not promoting size or number of children, size of family or number of children. What we're interested in is in childbirth spacing. So they all accepted that. And of course, what is most important for this group is that we promote priority health behavior from a religious perspective. So we know how in Nigeria, for example, people are highly religious. So we know that when people hear their religious leader, for example, talking to them, or community leader, for example, talking to them, we know how people take those things personal. So particularly for family planning, there were religious perspectives that backed up the support of family planning in Quran and also in the Bible. So of course, normally they will use that particular quote to engage their audience, and this really worked. The results we documented in family planning when we were doing family planning core intervention was basically from this experience. All right, so I think we've had a good chat here. So let's quickly also see what we can pick up from other organizations or from other projects. So I'd like to know, you can also use the chat box, or you can also raise up your hand and then we discuss. What do we need to take into account to implement gender-focused SBC programming in socially conservative environment, just like Northern Nigeria, as we have shared? And what challenges or barriers do we think we must address? So now this is open to all of us. We are currently running a particular project or the other. We are all from different countries, and the reason why we're here is because we want to also learn from, each other. So what do we think we need to take into account if we intend to do gender-focused SBC programming, just like the one we presented? You can raise your hand, you can use a chat box. What challenge or barriers must we address? Nobody? Burkina Faso, do you want to share in case you want to learn more from this? Do you think there's something we can?
Sure. I mean, I would say in our SBC strategy, we focused really heavily on changing norms around a variety of behaviors. And we focused on having an iterative and multi-channel approach. I think that that's something that's been really important to us, so that we have a few core behaviors and they're promoted across all of our different components. So whether it's the health component that's working through community mothers groups, or the livelihoods component that's working through cooperatives, all of them are talking about household decision making, and that's reiterated with a long-term radio drama that's also acting out those behaviors and demonstrating changes in norms and behaviors over time. So we find that iterative approach is critical, and obviously building in the religious leaders and other components. It's incredibly complex to get all of those different components aligned and working towards the same objectives, but we're hopeful that, especially in the current security environment where people are perhaps spending more time listening to the radio and a little bit less time with in-person interventions, that some of the mass media can really reinforce the stories that we're telling on a face-to-face or more in-person basis.
Thank you, Cheryl. Chizoba, are you still there? We can't hear you.
Apologies, I missed out on some of your discussion.
Hi,
Hello,
Chizoba.
can you hear me?
Yes, we can
Yeah.
hear you now. Cheryl just wrapped up what she was saying. Cheryl, do you want to comment on your last point, and then we can move on?
Okay, I'm not sure which part to reiterate. I guess multi-channel communication and alignment across all of the different components of a complex project help to make sure that those messages are there, and that the actors that can continue to reiterate them after the end of the project are also engaged and building in that sustainability component.
Okay, that's good. Any other comment on this before we move on? Any other projects? Yeah, great. Please go ahead.
Christine, in the chat, she mentioned a big challenge or barrier that we must address, GBV, gender-based violence and sexual violence. Christine, do you want to speak more to that?
Hi, everyone. Yeah, I mean, I support a program in Western Uganda that's using social norms change approaches to address violence against children, in particular sexual violence against children, which is, of course, a driver of so much. And I just was curious to know, to what extent, it's obviously such a sensitive subject, but to what extent you may have consciously or unconsciously decided to, discuss that issue in terms of, at least as it relates to your desired maternal antenatal and just the child spacing and any of the outcomes. But is it something that you discussed or addressed or acknowledged in any way across your program?
I think, yeah, so generally something that we discuss. So GBV is like, we always have identified, the project have always, the donors have always tried to make us address GBV issues, in a more specific way. But we also understand the context of our community and how this works. So we try as much as possible, like I mentioned in my presentation, every issues that we're discussing, we use priority behavior as an entry point. So yes, in addressing these issues, we try to wrap it around health issues. So that's how we have always worked around it, because we know how sensitive, and controversial, like you say, the issue around GBV is. So basically, we have just 5 minutes. I don't know if I responded to your concern. We have just 5 minutes, and I'd like to ask one more extra question. And this is also partly one of the questions that one of you also threw back to me. But I also want to learn again from all of us. How do we think we can measure positive sustained shift in gender or social norms? I mean, this is for everybody. What do you think we can do? We also have testified to the fact that measuring gender norms has always been a challenge in many projects, you know, because they take a long time. Even for social and behavior change, they take a long time and it's a process. So how do we think we can actually measure positive sustained shifts in gender and social norms? Let's hear from us, please. What do we think we can do before we go back to the plenary? How do we overcome patriarchal social behavior embedded in the community? Okay, Victor, we have that question, we'll pack it. This is part of the concerns that we want to hear people talk about. So how do we overcome the patriarchal social and behavior embedded in the communities? One of what we are doing is what we have presented today. So again, I know that there are other things we can learn, but in terms of measuring positive sustained shift, what do we think we can do? Anybody, please go ahead before we move. No one? I'm hoping to learn something from us. I can see Shekina here. I don't know. Yeah, I can see Sekina here. Sekina, do you have any contribution to this? No comments? Oh, wow. So nobody have an idea how you think we can measure positive sustained shift in gender? This is an area I was thinking would learn from us, and so that we can do better. That's one way.
There's no simple answer. To ask for a simple answer is quite complex.
Mm-hmm. I didn't hear that. Please, do you mind repeating yourself?
I think it's a complex question, so it's hard to get simple answers.
So basically just asking, how do we measure gender norms? When we say we are documenting positive change, how do we measure those positive changes? It's the same as one of the questions someone asked me earlier. So somebody mentioned in the chat box that we can do FGD to get feedbacks. I think that's one way, but do we have any other way? Beyond FGD. Okay. Since we still have a little more time, I think this is one of the areas we need to research more in, and also, yeah, how do you collect data? Oh, our time is up. We will research more. We collect data because we have a basic tool that we have given them, but like I mentioned earlier, we usually would give them will conduct a big survey or study on this to harvest the results from the communities. So that's what we do. Once again, I want to thank all of us for joining this group. I hope we have learned one or two things, and we will also continue this discussion beyond this meeting to continue to learn from one another on how to improve addressing gender and social norm issues using SBC. All right. Thank you everyone for joining us. Yeah.
Crier, bien sûr, avec des mégaphones, pose des questions. Et au départ, il y a celle qui